Are you preparing for your first nursing job interview? You've studied hard. Now it's time to speak with confidence, clarity, and care. In this video, we'll walk you through 30 of the most common interview questions for new nurses and show you exactly how to answer them with passion, professionalism, and poise.
Can you tell me a little about yourself?
Absolutely. I recently graduated with a Bachelor of Science in Nursing, and I've completed clinical rotations in paediatrics, geriatrics, and emergency care. I'm passionate about patient-centered care and excited to begin my nursing career in a team that values compassion and excellence. What made you choose nursing?
Nursing combines my love for science with my desire to help others. I've always been drawn to caregiving roles, and after volunteering at a hospital in high school, I knew this was the path for me. It's deeply rewarding to support people through difficult moments. What would you say are your strengths?
I'm a good communicator and I stay calm under pressure. During clinicals, I was often praised for my empathy and ability to build trust with patients. I also adapt quickly and enjoy learning new skills. What would you consider your biggest weakness?
In the past, I found it hard to delegate because I wanted to do everything myself. But I've learned that good teamwork and trusting others leads to better patient care, and I've been improving through practice and feedback. Can you share a time you had to manage a stressful situation?
During my ER rotation, a patient came in with a seizure. I focused on staying calm, followed my preceptor's lead, and made sure vitals were documented while helping reassure the family. It taught me how crucial teamwork and focus are in emergencies. How do you deal with challenging patients?
I try to see beyond the frustration and look at the root cause: fear, pain, or confusion. I speak calmly, listen actively, and keep my tone respectful. Often, just feeling heard helps patients become more cooperative. What would you do if you realized you made a mistake?
Patient safety comes first. If I made a mistake, I'd report it immediately, take responsibility, and work with the team to correct it. I also believe in learning from every experience to avoid repeating it. How do you prioritize your tasks when caring for multiple patients?
I start by assessing patient needs and urgency, who's unstable, in pain, or has time-sensitive medications. I use the OBCs, airway, breathing, circulation, as a guide, and always keep communication open with my team. Why did you choose to apply here?
I admire your hospital's reputation for excellence in patient care and your investment in staff development. As a new nurse, I'm looking for a supportive environment where I can grow, and your mission really aligns with my values. What's your approach to time management on a hectic shift?
I create a quick plan at the start of the shift, prioritize critical care, and document as I go. I also communicate with my team to stay efficient and avoid missing anything. Staying organized helps me remain calm and focused. What would you do if you disagreed with a co-worker or fellow nurse?
I'd speak with them privately and respectfully. I believe in addressing issues early to avoid tension. If needed, I'd ask a supervisor to help mediate. Communication and respect are key to maintaining teamwork and good patient care. How do you cope with emotionally difficult moments, such as losing a patient?
It's never easy. I allow myself a moment to feel and reflect, then focus on supporting the family and my team. I talk with mentors or co-workers afterward. It helps me process and maintain emotional balance. If a patient doesn't understand the medication you're giving them, how do you handle it?
I'd use simple language and break it down, why it's needed, how to take it, and possible side effects. I'd also confirm understanding by asking them to repeat it back or ask questions. What do you think are the most important qualities in a nurse?
Compassion, attention to detail, and strong communication. Nurses also need to be adaptable and calm under pressure. A great nurse listens, advocates for the patient, and works well with the entire care team. Where do you see yourself in your nursing career?
In the short term, I want to build strong foundational experience and grow as a safe, confident nurse. Long term, I'd love to specialise, perhaps in ICU or paediatric care, and eventually mentor others. What steps do you take to promote patient safety?
I follow protocols carefully, double-check medication dosages, and keep clear, up-to-date documentation. I also speak up if I see anything unsafe, even if it's uncomfortable. Safety is non-negotiable. Have you worked with electronic charting systems?
Yes, I trained with EPIC during my clinicals and also used Meditech. I'm comfortable with digital charting and understand the importance of accurate, real-time documentation for patient safety. How would you respond if a patient refuses treatment?
I'd stay calm, explain the importance of the care, and ask about their concerns. If they still decline, I'd document it, inform the medical team, and continue to advocate for their needs respectfully. How do you manage fatigue from long shifts or changing hours?
I prioritise sleep, stay hydrated and eat well. I also use breaks to reset and lean on healthy routines outside of work to stay balanced. I know that caring for myself helps me care for patients. Why do you think you're the right fit for this position?
I bring enthusiasm, a strong foundation in nursing practice, and a genuine desire to grow. I'm a quick learner, a team player, and I'm committed to giving patients the care and compassion they deserve. How would you handle a situation where a family member is angry or frustrated?
I'd stay calm and listen first. I let them express their concerns, then provide clear, compassionate communication. Families often just want to feel heard. If needed, I'd involve a supervisor to help resolve things professionally. What if you weren't sure how to manage a specific patient issue?
I'd never guess. I'd ask a senior nurse or supervisor right away. Patient safety comes first, and asking for help shows responsibility, not weakness. I see every situation as a learning opportunity. What's your approach to patient or family education?
I keep it simple, relatable, and interactive. I use visuals or handouts when needed and always check for understanding. I want them to feel confident in caring for themselves or their loved one. Can you tell me about a time you collaborated in a team setting?
During my clinicals, we had a patient whose condition changed rapidly. I coordinated with the nurse, doctor, and respiratory therapist to respond. It showed me how crucial strong teamwork is in delivering safe care. How do you handle feedback or criticism?
I welcome it. As a new nurse, I know I have a lot to learn. Feedback helps me grow. I take notes, reflect, and use it to improve my performance. How do you stay organised and focused during a busy day?
I use a small notebook or digital checklist, plan my rounds, and always double-check orders. I break big tasks into smaller steps to stay on top of things and reduce stress. What's your strategy for professional communication with staff and doctors?
I keep it clear, concise, and respectful. I use SBAR when needed, and if I don't understand something, I ask for clarification. Good communication keeps everyone aligned and prevents errors. How important is empathy to you as a nurse?
Empathy is everything. It helps patients feel safe, understood, and cared for, not just medically, but emotionally. It's what turns a treatment into true healing. How do you approach caring for patients from diverse backgrounds?
I respect every patient's beliefs and preferences. I ask questions, avoid assumptions, and make adjustments to meet their cultural or spiritual needs. Being open-minded builds trust and comfort. Do you have any questions for me?
Yes, thank you. I'd love to know more about your orientation program for new nurses and how your team supports professional growth. I'm excited to learn and would love to be part of that process.
You've got the skills, you've got the heart. Now, all you need is your voice. Remember, interviewers aren't just looking for qualifications, they're looking for someone who connects, who communicates, and who truly cares. Practice these answers, speak from the heart, and go shine in your next nursing interview. Good luck, and may your journey in healthcare be filled with compassion and courage.